Now, every time you have a procedure, there are incision lines. Now, with the facelift, what we try to do is that minimize the visible incision lines, and we hide the incisions within the hills and valleys and the shadows around the ears. Now, a good facelift, when it's performed, you should not be able to see any incision lines unless you come this close to the face. We're talking about within few inches of the face, and what you may see is a tiny little white line, very thin white line that kind of travels around the ears. When a patient comes to me and had facelift somewhere else, I can tell how experienced the surgeon was by just looking at the incision lines. Now, there are different types of facelifts based on the scar sizes. Traditional facelifts, the incision line goes into the scalp, around the ears, and it runs back of the neck. Now, unfortunately, when you perform this incision, sometimes you lose the tuft of the hair that is natural in front of the face, or you would see actually a line goes back of the neck, especially in men. That's very distressing. The way I perform my facelift is considered as a short scar facelift. I do not make a scalp incision, and I do not run my incisions all the way back of the neck. I try to minimize my incision by hiding it in the hairline. Then I go behind that little elevation and I hide an incision behind the elevation and right in the crease back of the ears. That's where the incisions has been hidden. So once the healing period passes, and I guess is about 3-4 months. First 2-3-4 months I tell people to use a little foundation to cover that incision line, which is kind of like a pink or light red color. Once the pinkish color has subsided and turned into a very faint white line, then there's no need to use any camouflage makeup on the face, and people can walk around without people detecting that this person had a facelift done.